Hi, my name is Dr. Ansel Johnson, and I want to speak with you a little bit about floaters. If you, just like myself and many other people, have these little threads, these little spots, these little things that seem like gnats or bugs just kind of floating around in your vision, and they're bothersome. You ever notice when you think there's something there and it's not there anymore? Well, a lot of times we call them floaters. A lot of times we don't have anything better to call them than floaters. Real scientific name. But they can be very, very bothersome. They can occur in one eye, they can occur in both eyes, they can come and go, they can be there all the time. And I've even had some patients report like when they're driving, they can be very distracting because they'll see a floater and they can always almost be in an accident because it's something that's not there, but yet there, they see it and they're not sure what it is. So yes, floaters can be very, very distracting, bothersome. They've been with us since time immemorial. So what are they? Well, the inside of the eye is hollow. It's filled with a fluid. It's filled with a jelly-like substance. And so some people think that the eyeball is, a solid object, but it's not. It's a very complex organ with many, many layers. So think about an eyeball almost like a carved out pumpkin, but inside there we have this fluid. It's a jelly like, real thick fluid that fills the eyeball that's optically very, very clear. So light can pass through and shine on the back part of the eye. And the back part of the eye is kind of like think of it as a projector screen where you have a light projector at a movie and it's shining this light on the screen. Well, that's what the back of the eyeball is. So everything in between, once it gets inside, light gets inside the eye, it passes through this jelly. And this jelly, it has little protein fibers within the jelly that come out from the edge of the inner layer of the eyeball and just stick inside the jelly and is holding the jelly firm against the wall in the inside of the eyeball. It's almost like these iron stakes that you see in concrete, these rods, and they pour concrete on these rods and it helps the concrete not crack and stay solid and adhere to the walls. Well, these little protein strands inside the eye do the same thing. They help keep that jelly not only solid, but adhered or sticking to the inner wall of the eyeball. Now, what happens over time, those protein strands can break off. Every now and then they break, and then when they break off, they're just floating freely inside the eyeball. And in a lot of cases, when we see these little protein strands, they might be stringy, they might be like little circles. They break off and then they pass in front of our line of sight. And it looks like some bug or some string is going across, and we wave at it and there's nothing really there. These strands can be of different lengths. They can be long, they can be short, they can be different shapes. They can be like circles, ovals, heart shaped or whatever, but they are many times very distracting and bothersome. Now, these little floaters can come and go. A lot of times these little strands can break off and then they settle down to the bottom of the eyeball, or they can actually self-dissolve within the eye. And so we don't see them anymore. But lo and behold, here comes another floater. Man, I thought those floaters had gone away. Now here comes more. Now, most of the time, floaters are really nothing to worry about, just more bothersome than anything else. But I also warn patients, if you see new floaters or large floaters, you need to come in and get your eyes checked and even dilated. Because on some occasions, not most occasions, but a small amount of occasions, they can be a sign of a tear or a hole or detachment in the inner layer of the eyeball, or what we call the retina. And if you are living with diabetes or high blood pressure, you really need to pay special attention to that floater, because that can also be a sign of bleeding or a broken blood vessel inside the eye. So you really need to get checked out and don't ignore new floaters or larger floaters or changes in your floaters if you are living with diabetes. And generally, anytime. I'm living with floaters right now, and they tend to be really, really bothersome. So again, floaters are little bits of protein strands or material that's inside the eye that are broken off and they're floating freely inside the eyeball. And then when it goes in front of your line of sight, you see it. And usually if you're looking against like a real light white surface, that's when they're more noticeable. Sometimes people notice them in the daytime when there's a bright sunlight or again, a white or light colored back surface. And so the next question is, can I do anything about it? Well, up to a couple of weeks ago, there's really nothing we could do. We could just tell people, well, floaters will generally go away. Hopefully they'll get better over time. Sometimes they never go away. They were experimenting with some surgical procedures, some injections of different medications in the eye to help dissolve them. But the bottom line, sometimes when you go inside the eye surgically, it can cause more problems, even cause more floaters. So there's nothing, no real big standard of care in terms of helping to eliminate or reduce floaters. It just tended to be something that we tell people, well, you're just gonna have to live with it. And hopefully they'll go away over time, which is true in a lot of cases. Floaters may go away a little bit over time. A lot of times people have cataract surgery and they've been seeing fuzzy for years sometimes, or in the short time the vision's gotten worse from cataracts, and they have tons of floaters, they just haven't noticed it because their vision has been very blurry. Then all of a sudden they have cataract surgery, and now they see all these floaters because they see clear, they see bright. And then sometimes once you've had cataract surgery, it can kind of stir up floaters. You're digging in the eye, and some of these protein strands can break off inside the eyes. And so they notice them a whole lot more. And they can really be even more bothersome after a miraculous, easy procedure like cataract surgery where they're seeing so much better, but now you see all these floaters that are distracting because now you have very new clear vision. Well, I have to inform you all that now there is new hope for people that are living with floaters. A very natural remedy. And there's this study that just came out. And I got this email a couple of weeks ago and I read it and it's like, wow, there's actually some hope for people with floaters. A very natural, non-surgical treatment for floaters. There's a study that was done, and it was a small study, about 61 patients, and they were randomized. When we talk about randomized double-blind studies, some people got the product, some people did not. And basically the bottom line that people who received this product actually got a 67% improvement in their vision function. And this product is filled with a number of micronutrients. 67%, so almost 70% of people get improved visual function. Some people get decreased floaters, decrease in size and frequency. Some people got decrease in visual discomfort from floaters. And almost 10% of people actually get improved what we call contrast sensitivity. In other words, things seem more sharper, had more contrast. So this is very exciting. I was so excited to read this email. I looked at the study and I was like, wow, this is good. It's a small study. And I guarantee there'll be more that come after this. But there is really hope for people with this. And so as soon as this came out, and I saw this, I read the information, I saw the product. Product is made of very natural substances that are vitamin supplements that are micronutrients that have been around for many, many years. These are the products that are in this supplement. Zinc. Got to be a little careful with zinc, but zinc is present. Vitamin C, grape seed extract, citrus fruit extract, and also L-lysine. So again, zinc, vitamin C, grape seed extract, citrus fruit extract, and L-lysine. And there are a few other ingredients to help stabilize the product. So to get all those products and to engulf them and not being the right combination is kind of tough. But what they've done, they put all of these ingredients into one small supplement. And boy, I'm starting to take this stuff this week. I am going to take it myself. I've taken other products from this company, and they're very good, high quality products, vitamins for the eyes. And so, you ready for the name of the product? The product is actually called Vitreous Health. Vitreous is the name of that jelly that fills the inside of the eyeball. So scientifically, we as doctors, we call that the vitreous. So this product is to help reduce the visual discomfort caused by floaters. We are not carrying that now. Again, the study has shown that it's helpful in almost 70% of the people that take this product. Now, you need to take this product at least 6 months. That's what the study showed. So the study was over a period of 6 months. So it's not taking a couple pills, oh, it's going to dissolve my floaters. Doesn't work like that. As with most natural substances, remedies, it takes a while. And what, 100% of people benefit from this? No. But again, what this study showed is that 61% of these people in this study showed an improvement in visual function or decreased visual impairment from floaters. Those are pretty good odds, and I think worthwhile. So how do you take it? You take this one little supplement once a day with a little food on your stomach for 6 months. And then again, as the study showed, almost 67%, so almost 70% of the individuals that participated in this study showed improvement. And of course, check with your doctor. I just gave you the names of all of these supplements. Check with your doctor, make sure it's okay with your eye doctor, with your medical doctor, to take this supplement. And it is available in our office, Vision Salon Eye Care Associates. So if you'd like to come in and get this supplement, I strongly suggest that we have your eyes examined first to make sure everything's healthy. There's no other issues that are causing your floaters medically. And then feel free to order this product from us. That's about all for now, but this is such exciting news, hot off the press. Product studies literally been less than 2 or 3 weeks out this month of May 2022. Again, call Vitreous Health. Give us a call, set up an appointment. We'll check your eyes and see if Vitreous Health is appropriate for you. Check with your physician or your eye doctor to see if it's appropriate for you, because we want you to be well, see well, and be blessed. Thank you very much.